I'm Dr. Alexander Diddick. I am a pain medicine, interventional pain medicine, as well as sports medicine specialist. I work for Healthy U Clinics, where I serve as their director of pain medicine. Happy for everyone to kind of join me today so we can talk about SI joint pain and a minimally invasive kind of treatment that can be a wonderful tool to be utilized in SI joint pain and low back pain moving forward. So patients will come into me in my office, and one of the number one complaints, of course, that we see when we're pain medicine specialists is back pain. It's often our job to play detective a little bit to help differentiate where that pain is kind of coming from in our body. If I have patients coming in saying, "Hey, it's really hard for me to stand up when after being in a sitting position, my pain can be almost kind of unbearable," that is suggestive of SI joint pain. We're going to talk a little bit about a slide from now about what SI joint pain, but that stands for sacroiliac joint pain. So where the buttock bone that we sit on, the sacrum, meets our hips, that's the ilium, and the iliac bone. And where that area is a little bit lower. It's kind of where we're sitting. So if we're in a long car ride and we say something like, "I'm shifting in my seat and I can't stay comfortable for a long period of time, and getting in and out of the car is causing me pain," that's also suggestive of SI joint for short pain that we're dealing with. I'll have patients where we're trying to differentiate where this pain is coming from our history and physical exam. We're often doing things like injections, where we're putting medicine directly into that joint. And those injections can have various degrees of success. Often, if that pain is coming right back, the first thing I ask them is saying, "Is it the right spot?" Because if I put numbing medicine into someone's joint and it takes someone's pain away, even for a short period of time, I can say with a lot of confidence that that pain is being generated from the SI joint. I'll have patients that feel like every little move they make can make them kind of jump up and scream. And sometimes we are still trying to differentiate if this is coming from, let's say, the spine itself or coming from something like the SI joint, but very often or not, it is the SI joint. And depending on patient population, we'll be talking about this as well. Some people are at higher risk for developing sacroiliac joint pain versus someone else. The last example that's kind of painted down here says, "I can't get rid of the pain. I couldn't do anything. I couldn't unload the dishwasher. The pain is taking my life away from me." And I see that as well with patients, that what we're really trying to chase or trying to get kind of better with patients who have ongoing back pain isn't just the pain, but it's how it's affecting our quality of life and function. Quality of life and function are key. I don't want patients to sit and not do anything and tell me they have no pain. That's not good enough. I want you to be able to do your activities, which include getting up and walking, or being able to do things around the home, or hang out with your family or friends, or activities that people enjoy that they no longer do. I have a patient kind of recently tell me that they no longer are able to bowl, and they're no longer able to golf, and it's because of their pain that they're experiencing. And in both of those cases, it was related to the SI joint. So we look at we have a multimodal approach, a holistic and kind of broad approach to taking care of our patients here at Healthy U Clinics. So we look at the person and we look at all the factors that are kind of going into their life and lifestyle that make up who they are and why they may be having pain. Often for things like sacroiliac joint pain, patients have tried medications. They've maybe gone to physical therapy. They might have done chiropractic care. We might have gone down the road of doing injections. They might have had things like epidural injections before. Maybe this patient's coming to see me after they've had back surgery or spinal fusion before. These are all various kind of modalities that patients are trying to utilize, including very stronger pain medications such as opiates. And when we are running out of options or we've gone through a bunch of different treatment modalities, we then start talking to them very often about sacroiliac joint fusion, or a posterior minimally invasive percutaneous implant that we talk about with pain tech. So this is what I was alluding to. This is your sacrum bone on the right over here that we can kind of see kind of this kind of cursor to this middle kind of structure on the right. That's the butt bone that we sit on that we all can kind of feel. And where that attaches to our hips is the ilium bone. And this kind of chasm in between the two is the sacroiliac joint. And so when patients are developing sacroiliac joint pain, it's often a combination of things. It could be too much movement or too little movement. And generally speaking, this joint doesn't want to move very much. And so it's also dependent on maybe there is on one end of the spectrum too much laxity to that joint, so the ligaments aren't kind of tight enough. We'll talk about how that happens. Or the other end of the spectrum is as we age, we may develop arthritis, and that joint space narrows. And now when those joints are moving, or when that joint is moving, it's causing pain when the bones are rubbing it against each other. So sacroiliac joint pain, on average, is about 1 out of 3 people. When I wrote an article a few years back on sacroiliac joint pain that's on Google that you can look up, and it ranges between about 15 to 40% of people. It really depends on the patient population. Some people are at higher risk, and again, we'll talk about that in a later slide. But ultimately, it is one of our top things on our differential in terms of, is this coming from the SI joint? Is this coming from the discs in someone's low back? Is this coming from the little joints in our low back as well that might be causing the pain or irritation? The one thing that the SI joint has that those other pain generators don't is the location. Every one of us can feel our SI joint pretty low on our low back. And a lot of times we're kind of pushing on. If someone looks in the mirror and they may see kind of little dimples on the back of their back, pretty low, kind of right where we're sitting. That's often right the location of the SI joint. And when I push on that on patients and they jump out of their chair, I'm pretty certain it's the SI joint that's causing it. So let's talk a little bit more about this. I was alluding to this in the previous slide, but there's different patients who have SI joint pain. There's not a one size fits all. Not everyone fits into this perfectly. But on one end of the spectrum, I might see someone who was in a car accident. I might see someone who was recently pregnant and had a childbirth, and they start developing back pain afterwards. And that back pain may or may not be due to either stretching or tearing of ligaments in their low back. Very commonly with childbirth, to be able to deliver a baby, we need to be able to have some relaxed ligaments and structures in our low back and groin to be able to pass a child. And ultimately, when that happens, those joints may be still out of alignment long after childbirth, where I see chronic pain that may be stemming from multiple years after having a child. Similar when someone's in a car accident or trauma, they fall down. This may also kind of cause kind of injury or trauma to that. And one of my most common ways I see SI joint pain is someone who's previously had back surgery. Once someone's had a lumbar fusion, so the joints in the low back are fused together, it puts very significant strain onto this SI joint, which becomes a very kind of chronic area of kind of low back pain. Now, there's multiple symptoms that we look at when we're talking about SI joint pain. Again, localized to the low back, localized to that area, I often is the primary kind of symptom. But there also can be kind of vague as well, where there's a radiation or a referral pattern to the pain as well, where it's either kind of radiating at someone's hips, their thigh, or their groin. It can be very positional, kind of related. It wasn't on one of the previous slides, but on this slide even kind of alludes to it, saying, you know, if I have someone telling me that going up and down stairs really bothers them, getting in and out of the car is really troublesome, I'm thinking it's the SI joint pretty quickly. And we mentioned too that when we're looking at that flexibility of these kind of joints, the other end of the spectrum might be more of an arthritic kind of centered reason for the pain. And arthritis is loss of cartilage. So bones have kind of cartilage to kind of help kind of coat, help those joints kind of slide. And as we age, that cartilage is lost. And when that happens, the joint itself becomes narrower. When that occurs, those bones are rubbing against each other, and that can be painful as well. So there's usually two sides of patient populations for SI joint pain. There's a younger population that might be in their 20s and 30s, and then there's a lot of times an older population that may be closer in their 60s. Now, that doesn't mean we don't have SI joint pain in between, but they're just more likely to be seen in those age groups. Okay, now we get to talk about the Link-Q procedure for SI joint pain. Part of the reason why we had a conversation about all the things that were maybe utilized for SI joint pain is if this pain is chronic and ongoing, those are often temporary measures. And what I love about this procedure is this can be a permanent solution. And as a permanent solution, it can be a minimally invasive treatment to providing really significant long-term relief, not just of pain, but again, as well as improving function and quality of life, which is kind of the whole point, ultimately. We want to be able to do the things we want to do and not have to think about our pain. What's amazing about this, and when I showed this to patients, is the implant that we're putting into the joint to help reduce mobility within the joint and distract the joint and give it some more space. It's about the size of an almond, as you can kind of see on the bottom of the screen. When we do this procedure, we often do this at the surgery center, and it's outpatient. Patients come in, they get kind of set up for the procedure, and then they're out of the surgery center within 30 minutes after the procedure. And the whole procedure often only takes us about 20, 30 minutes in most cases. It's a small incision, about the size of a thumbnail generally, so that we can get the implant into the joint. There's no drilling, no screws that are done. Really, we're just trying to get to the point into the joint where we can kind of insert this implant, essentially. The recovery time is quite quick as well, and the complication rate is very low. So what is this allograft made of that we're kind of putting into it? And the LinkQ implant is made of cortical bone. So this is kind of a hard, kind of bony layer that if you kind of tapped on your leg, you kind of feel that's cortical bone. And then within the bone, there's cancellous bone. So cancellous bone, as you can see for our implant, it's hollow. So what we do is we put a bone putty in there that basically simulates the cancellous bone. And what happens is when we put that within the joint, it starts causing fusion as well over time because it's sitting in between the sacrum as well as the ilium bone, and in the middle of that is where that allograft is being placed. Pretty amazing tool. So how it's done, talked about this a little bit. Let's see if the video kind of plays, because the picture's worth 1,000
PainTech's Link is an innovative way to solve patients' SI joint pain, using SI stabilization with a minimally invasive medical procedure. Patients get long-term benefits and faster recovery than other SI fusion methods. The process is broken down into 4 steps. First, the Steinmann pin is inserted into the SI joint, between the sacrum and the ilium. There is no drilling involved. Next, the tissue dilator and working cannula are inserted, creating separation in the joint. Then, the broach rasp is inserted to create room for the link allograft to fit comfortably and at the same time initiate decortication. The broach and rasp are removed with a simple unscrew, reverse hammer, and pull motion. Finally, a large graft window of the link allograft is filled with DBM and placed into the SI joint. The inserter ensures that the link is positioned perfectly, allowing SI fusion to begin. This step helps create the perfect growth environment for link to work. Link enables you to fix the pain, not mask it, allowing your patients the ability to take back their life again.
Well, that was great. I think that explains quite a lot, ultimately. I think one thing that is worth kind of talking about with that procedure is it's amazing to me, you'll see a patient and they just have this done and they say their pain is better. And from a medicine standpoint, that joint takes time for it to fuse. Okay, so what a lot of times what we're doing initially and why people start feeling such great pain relief, even a lot of times right away after this procedure, is we distract the joint, which is we're opening that space up. We're giving basically that joint a little bit of room to breathe now that there's that allograft that's being placed in there. And then over time, over the next ensuing weeks to months, it actually fuses that joint so that that can become a permanent solution. And we're going to talk about kind of post-operative care, but during that time period, we want to limit our excess limiting, bending, and twisting of things so that it kind of stays where we want it to be. So caring for it, what do we expect afterwards? Anytime we break the skin, we even kind of make a small incision, we want to reduce any kind of infection risk, right? So we're trying to avoid scrubbing because we have bandages and some steri strips a lot of times, or a few stitches that we put into it while it's healing. We want to kind of make sure that we're just kind of protecting it and keeping it kind of dry as it can kind of heal. For about 6 weeks after the procedure, we try to avoid our excess movement, right? So we're not going to be lifting too much, but we're able to walk, we're able to do most of our activities. I just don't want people going back to golfing 2 days after the procedure. That's not how it's meant to be. We want to avoid basically our BLT is bending, lifting, and twisting as much as we can, or strenuous activities at that time. We want to then start increasing that activity as tolerated. Really, that first 6 weeks is kind of healing, kind of fusing, and then generally I have patients go to physical therapy at that point. Physical therapy is a really good way for a couple of reasons. One is a lot of times when someone's in chronic pain, we're not moving as much as we'd like to, right? And so if the pain is feeling better, the muscles around that joint, the ligaments and joints around that joint, a lot of times atrophied, or they're not working to their full extent. And so what we need to do is kind of reactivate or help those muscles kind of get back to where they belong, so that you're able to do activities without being in pain. not just from the SI joint, but from all the other areas of our body that kind of work in conjunction with each other. And these are some kind of general success stories. Take a look at these. I'll tell you mine as well. Patients will come in and see you, and then they're no longer using a walker. I think that's amazing, where patients kind of stand, kind of walk, kind of pain-free. Also see patients who say, hey, I've been on kind of chronic pain meds for quite some time, and I don't feel like I need to be taking it nearly as much or not taking it at all anymore. And I think that's great as well. I think the other thing that always kind of makes me laugh is we talk about our body kind of works in conjunction, and I'll see patients who are walking and doing things more. And now from walking and doing things more, they're not used to it. And so now I'll hear things saying like, I just get kind of wiped out pretty quickly because I didn't realize how out of shape I've been for so long. Here are some patient testimonies that we're going to look over as well.
Before the link procedure, I couldn't walk very far. I was in so much pain that I was willing to try anything. I've had injections, and I've also had bricks inserted into the SI joints, and they were not working. When it came to the point of being confined to home and losing independence, my reservations went on vacation. If you're going to prescribe medicine, I'm not going to take it. He said, that's good, I don't prescribe it. So we're going to get along just fine. To me, it was like pain-free. And trust me, I've had more than my share of procedures. He got me all prepped, took me back there, and then they said, you can get up now. You're done? I mean, that's how quick and easy it was. I saw results right away. I just noticed that the pain is gone. It's great that I'm where I'm at. I'm back up and mobile, and I'm very thankful for every day that I live.
Okay, now we're going to just do some kind of frequently asked questions, and then if there's any kind of questions from the audience, I'd be happy to answer that as well. So we'll start with the top left corner over there. So does this procedure require any kind of overnight stay in the hospital? No, it does not. This is an outpatient procedure that you're going home within hours after the procedure. Is it covered by Medicare? Yes, as well as covered by private insurances as well. If patients had lumbar surgery, including a lumbar fusion, is this something that people are candidates for? Absolutely. Actually, that's often a very good candidate for this kind of procedure is someone who has persistent back pain following lumbar surgery. As I mentioned, there is some increased strain onto the SI joint after someone's undergone lumbar surgery. What about other procedures, such as spinal cord stimulation, radiofrequency ablation, or injection? Yes, I think there can be multiple pain generators going on in someone's body, or they've tried other therapies, and then this is an option as well. Their imaging is still optional, so the top right, patients can still have MRIs and CT scans. That's perfectly fine. There's nothing interfering with that as well. Will I get immediate pain relief? As I alluded to, in some cases, yes. When we distract that joint, we open it, we kind of give a little kind of a buffer or a spacer that's being placed in there. The joint isn't kind of rubbing against each other, causing that much irritation. Patients can feel pretty good right away. There might be some post-surgical pain for the first few days, and then noticing the pain is getting much better. And then over that course of that next kind of 6, 8, 12 weeks, as it kind of continues to fuse, then we're really looking at significant long-term pain relief. Last question on the bottom right corner is asking if this can be done on both sides. Can be done on both sides. We're usually doing one side. We're picking the side that bothers us most. A lot of times that imbalance that's occurring, right? If we're favoring one side of our body because the other side is painful, the other side might start hurting a lot. So it's also not uncommon if you're kind of picking the side that is more painful on someone, the other side starts feeling much better as well. But yes, both sides can be done. Typically, we are waiting 3 to 6 months in between that. Every patient we see, we're going through all the steps to kind of take care of someone, right? So ultimately, we are doing our best to manage people the best we can any way we can, okay? We're examining people, we're doing their history, we're doing their exam. We're going step by step going through this to manage people and take care of their pain, okay? So happy to take care of you. Happy if you have any questions, feel free to reach out to us and see us. Thank you.